Are you concerned about the possibility of developing breast cancer? If so, you're no doubt wondering if there is anything you can do to help prevent or reduce your risk of breast cancer. The fact that you are a woman and above 50 years of age are major risk factors, and there is nothing you can do to change your sex or reduce your age. The next major risk factor is your family history, and this too cannot be changed. The good news is, there are lifestyle changes you can make to lower your risk. What can you do to reduce your risk of breast cancer? Research shows that lifestyle changes can decrease the risk of breast cancer, even in women at high risk. To lower your risk, limit the use of alcohol, for the more alcohol you drink, the greater your risk of developing breast cancer. Therefore, it is recommended that limiting yourself to less than 1 drink a day is the wise thing to do, because even small amounts of alcohol increase your risk. Don't smoke. Evidence suggests a link between smoking and breast cancer risk, particularly in perimenopausal women. Control your weight. Being overweight or obese increases the risk of breast cancer. This is especially true if obesity occurs later in life, particularly after menopause. Be physically active so you can successfully maintain a healthy weight, which helps prevent breast cancer. Most healthy adults, especially women, should aim for at least 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic involvement on a weekly basis, plus strength training, of at least twice a week. Breastfeed. Breastfeeding plays a role in breast cancer prevention. The longer you breastfeed, the greater the protective effect. Limit the dose and duration of hormone therapy, for it increases the risk of breast cancer over time. If you're taking hormone therapy for menopausal symptoms, check out other options with the help of your doctor. Do you feel you can manage your symptoms with non-hormonal therapies and medications? Maybe. However, if you decide to try short-term hormone therapy in belief that the benefits outweigh the risks, it would be advisable you use the lowest dose that works for you and continue to have your healthcare personnel monitor the length of time you're taking hormones. Avoid exposure to radiation and environmental pollution. Medical imaging methods, such as computerized tomography, use high doses of radiation. Some research suggests a link between breast cancer and cumulative exposure to radiation over your lifetime. Reduce your exposure by having such tests only when absolutely necessary. Can a healthy diet prevent breast cancer? Eating a healthy diet decreases your risk of breast cancer, even including risk of diabetes, heart disease and stroke. The Mediterranean diet, for example, focuses mostly on plant-based foods, such as fruits and vegetables, whole grains, legumes, and nuts. People who follow the Mediterranean diet procedure choose healthy fats, such as olive oil, over butter and eat fish instead of red meat. Maintaining a healthy weight can also be a key factor in breast cancer prevention. What about birth control pills? There's some evidence that hormonal contraception, which includes birth control pills and IUDs that release hormones, increases your risk of breast cancer. However, the risk is considered very minimal, and it further decreases after you stop using hormonal contraceptives. Discuss your contraceptive options with your doctor or healthcare advisor. Of course, there are some benefits of hormonal contraception, such as controlling menstrual bleeding, preventing an unwanted pregnancy, and reducing the risk of other cancers, including endometrial cancer and ovarian cancer. What else can you do? Be vigilant about breast cancer detection. If you notice any changes in your breasts, such as a new lump or skin changes, consult your doctor. If needed, ask your doctor when to begin mammograms and other screenings based on your personal history. If you are already a victim of breast cancer, you can reverse the situation completely, STC30, and that, even if you have been in that situation for many years. Of course, you can also use STC30 for prevention. Call or WhatsApp us on +234 7025 4266664, or contact the person who sent you this video. Stay safe.